Welcome. I'm Bob, co-founder of NWT Wellness, and I'm excited to introduce you to one of the most effective and accessible tools in your arsenal, the NWT Wellness Phototherapy Portable 660 nanometer red therapy light. Now, the 660 nanometer wavelength is known for its ability to penetrate deeply into the skin surface and stimulate cellular repair, reduce inflammation, increase blood flow, and support circulation, all without discomfort or any type of downtime. Now, in applying the light, it's essential that you directly put it on top of the skin, because red light loses its therapeutic potency when there's distance involved. It starts to spread in every direction except where you want it. So skin contact ensures maximum absorption and cellular activation. So whenever you're working with, say, a muscle recovery or emotional release, or even skin rejuvenation, this tool is intuitive, it's powerful, and it's ready to integrate directly into your practice. So let's explore how it can elevate your therapy sessions and deepen your clients' results. But before we dive deeper into protocols and positioning, let's take a moment to appreciate how simple it is to maintain your red light therapy unit. Now, each device runs on three AAA batteries. It gives you the flexibility to use either alkaline or rechargeable options, depending on what you would prefer to use. Adjusting the beam is effortless. Just pull or push the front area of the unit to widen or even narrow the focus, depending on the needs at any given time. And at the rear, you'll find a single button that cycles through the 5 distinct settings with each click. It allows you to tailor the intensity and the pulse patterns to your client's needs in real time. And for peace of mind, every unit comes with a 1-year bumper-to-bumper warranty, covering everything except battery replacement. Well, that remains the responsibility of the unit's owner. So let's see, it's intuitive, it's low maintenance, it's portable, and it's built to support your practice with ease. What else could you ask for? Now, just to reinforce the quality of our units, we've been providing these units for close to 10 years now, and we've only had to replace maybe 10 units due to any type of malfunction. But like any tool, our red light therapy units occasionally need a little attention, and we've made maintenance and troubleshooting as simple and intuitive as red light therapy itself. So let's go over some of these things that we've seen in the past. So if the light doesn't turn on, first check the battery orientation to ensure that all 3 AAA batteries are in the holder correctly. They go in a specific way, and if they're not in that way, they're not going to work. But once you confirm that they're in there correctly and the problem continues, you most likely need to replace those batteries. Another thing is if the beam of light seems to dim or becomes inconsistent, it's often a sign that the batteries need to be replaced or recharging if that's what you're doing. And another thing is when we find that settings aren't cycling as expected, that is to say that while you're using a steady beam and all of a sudden it starts to flash on its own. In other words, you didn't ask it to do it. This too is an indication that the batteries are needing to be replaced. So it will work better if you do it that way. So another thing, if your unit is sitting on the shelf for say 30 days, you need to remove the battery carrier, since that could start to corrode and it creates a battery acid, and that could really damage the interior workings of your unit. Now, one other thing, a very important thing actually, is something that needs to be done on an annual basis. The threads on the cap, right around here, need to be lubricated with a small amount of petroleum jelly. It keeps these 2 seals soft, and it also keeps it waterproof. And over the past 10 years, we've made significant upgrades to all our units. Refinements, it's been driven by real-world use, even practitioner feedback, and even our own evolving standards of excellence from the early days. Our devices featured a lightweight housing and a basic design. Although it was functional, it didn't really reflect the durability or the precision that we'd envisioned. So as our community grew and the protocols became more advanced, we knew it was time to evolve. That's why we transitioned to our present style. And initially we had a unit that was just on-off, just you turn it on, you turn it off, and it had a single red diode. And it wasn't really the unit we were looking for. We then moved into a 3-mode or setting model, which gave us a little more availability as far as flexibility, but again, it only had one red diode. Next, we actually started to find this unit, and it had 5 modes. And we played around with it a bit, and we found that it was actually a much better situation, gave us the type of flexibility we were looking for, the durability we were looking for, and it really, really enhanced our program. The next real big upgrade, and actually improvement that happened, it was probably the biggest improvement that we had found at the time. And we found that most of the existing light units you could buy on the marketplace didn't have a 660 nanometer red diode in them. And we'll cover that in a little while as to why that's so important. What we found that the diodes that were in these units varied anywhere from 620 nanometers to 640 nanometers. And again, the 660 is really important. And it was at that time that we researched and purchased true 660 nanometer red light diodes. And we bought them directly from the manufacturer. And we learned how to install them ourselves and put them in our own housings. So it was also at that time, and through that same manufacturer, that we discovered we could get replacement diode packages that contained more than one 660 nanometer diodes. So what we did, we ordered a few of those that way, and we tried them in our own lights on the field. And the results we were getting was unbelievable from our clients, both animal and people. The feedback was tremendous. Much better results, faster results, better penetration. The people were just so much happier. Also, all of our various portable therapy units have a 4-diode profile, including our blue lights, our green lights, even our near-infrared lights, and of course our red light. The important point here is that our lights have greater intensity, as well as guaranteeing proper penetration to the specific and correct levels within the human body. The greater the penetration, the greater the results. What that does, it ensures that your client is receiving the greatest effect from the actual light session. Now, one of the most popular questions that we're asked is, why are the red lights set to 660 nanometers? Here's what I told you I'd explain. It's a simple answer. The 660 nanometer setting is the energy level that closely matches the energy signal that every cell within the body emits, thus receiving the greatest results in each session. So what that means is when the energy from the red light enters the body, it has the ability to match up with the energy emitted from the cells within the body, so that it can actually work together hand in hand. So, and another thing with our lights, the main feature is our 5 distinct settings. Each setting is designed to meet your client's needs. 1 light, 5 settings. It all allows for infinite transformation. Now, our current models offer the 5 distinct modes or settings, each designed to meet the body where it is, from the surface level care to deep tissue penetration. Here's how each setting supports targeted, intentional healing. The first one is the low continuous beam, surface level support for skin clarity and comfort. This gentle setting is ideal for addressing concerns limited to the first layer of the skin. Use it for calming surface that are irritable, like insect bites. Promote minor discomfort or irritating, you want to actually, anything that's irritating is a slight abrasion. It can all use for that. 2 clicks and you come up to the medium continuous beam, solid beam. It's for deeper care for the second layer of the skin. Perfect for more involvement in skin support. This setting reaches into the living layers of the skin. It It's commonly used for promoting circulation, easing minor discomfort, supporting skin vitality beyond the initial surface. 2 clicks and you get to the high beam continuous. Deep tissue activation here, and it goes beyond the 3rd layer of the skin. This is your go-to for muscular tension, joint support, and deeper therapeutic needs. It penetrates past the first 2 layers of skin, reaching the connecting tissues and fat layers where long-held tension often resides. Next, we move into the initial pulsing setting, used for precision targeting within the thermal control. Now, when we talk about thermal control, when you actually put the light on the skin, there's no heat generated. But what it does do, it starts blood flow, it starts reducing inflammation, and both of those create motion internally. So internally you're going to feel you might feel a slight heat, and that's what they talk about thermal control. And what thermal control does, it's designed to minimize the surrounding tissue's involvement, and thus the pulsing mode allows for focused treatment. It's ideal for targeting specific blood vessels or deep tissue areas, at the same time controlling the amount of internal heat that's created. So what that does, the pulse or the brief delay in between the pulse creates what's known as this thermal relaxation window, and that's to enhance the safety and the effectiveness of the treatment. And 2 more clicks and you get the extended pulse setting. Now this enhanced precision. This is enhanced precision with a longer thermal relaxation window. And it's similar to the initial pulse setting. This setting extends the pulse delay, allowing for even more refined targeting within the 3rd layer of the skin and beyond. And it's especially useful for sensitive areas or where precision is really paramount. All of that matters when you're supporting an arm joint, a leg muscle recovery, or even an emotional reset. These 5 settings or modes give you the flexibility to meet each situation with care, with clarity, and of course with confidence. Now I want you to understand that red light therapy doesn't just treat something. Actually what it does, it activates. Every session initiates the body's 3-day healing rhythm that works in harmony with the body's own intelligence. So let's talk about how each phase unfolds. So day 1, in other words, the first 24 hours. So phase 1 is called the reaction phase. This phase begins the moment your session starts and you put the light on the skin. And it continues through the first 24 hours. Red light interacts with the autonomic nervous system, gently stimulating the body's innate repair mechanism. This is the ignition point where light meets biology and the natural healing journey begins. So that's the first 24 hours. Now day 2, which is the second 24-hour period, is called the regeneration phase. It starts with repairing nerve connections and accelerating recovery. It is at this point that light energy starts to search out areas within the body that needs the most attention. Now this is just like kinesiology. You might find that you feel that there is a problem in a specific area, but by the time you start realizing that there are other areas affected, just like this, it works the same way. Light energy will search out the areas that need the most attention. Here's where the body starts to rebuild and nerve pathways reconnect around the needed areas. And movement becomes healing. Gentle physical activity during this phase will enhance recovery. What people need to do is they need to continue their lifestyle once you do a red light treatment. They need to go out. If they garden, they need to continue to garden. They need to mow the lawn. They need to go for walks. If they're tradespeople, they continue to work. It will not work effectively if they don't go out and continue the movement. So what we've done with the light therapy is we've started, to create a situation where we've reduced inflammation and we have increased blood flow. We want that to continue, and movement will help to continue that situation. And that will strengthen any damaged tissues It will accelerate movement, will accelerate the overall recovery of the affected area, and it will also start to reduce the pain cycle. All these are important in the actual using of red light therapy. Plus, it will increase the oxygen and nutrients that are actually delivered to that area. So it's going to add additional healing ability. And it will help expand the range of motion in the affected area. Now, all of this happens, and all of this is actually when the body's in active repair. Right now it's responding, it's rebuilding, and it's renewing. And once that continues, it sort of just falls into phase 3, or the third 24-hour period. And that's called the remodeling phase. It's at that point that you start to see the restoring of healthy function and long-term resilience. And by the third day, the body begins to remodel the treated and affected areas. It starts restoring elasticity, flexibility, and it starts to look like full function again. Movement continues to play a vital role. Even in the third day, they have to be out there moving around, continuing movement, keeping that blood flow going. Again, restoring muscle and joint flexibility. It improves the oxygenation. It prevents chronic pain development. All of these things, again, are all part of red light therapy. And when you do it this way, you get an increase in the range of motion. This is something that really needs to be stressed to your clients as you do red light therapy. Now, once the third phase is done, it leaves the body stronger, cleaner, and even more aligned. And you can start 3-day cycles as many times as you feel necessary. They can work independently of each other, or they can work in conjunction with each other. You can have someone come in and then 4 days later do a second one, or you can have them come in day 1, day 2, day 3, start 3 different 3-day cycles all at once. We found no side effects from red light therapy when you choose to do daily sessions, when you choose to do the 3-phase system, even when you choose multiple sessions on a daily basis. Now, understanding this natural body rhythm helps you, gives you better timing of your sessions. It supports recovery time and honors the body's natural intelligence. Like I said before, whether you're treating an arm joint, a thigh muscle, or even a tension, red light therapy works best when you work within the 3-day phase cycle. Now, when we entered the red light therapy industry, there was no roadmaps. It needed to be clarified. It needed care, and it needed to show results. There was no road to follow, so we built one. And our instructional manual line has borne over a 5-year period of hands-on in-field work, real-life protocols, and a commitment to making red light therapy understandable and effective for everyone. So, today it stands as one of the most comprehensive and accessible resources in the industry. And what I want to do is I want to kind of show you what we do have. So let me get the pile here. And we've got books for dogs. And these aren't just little pamphlets. This one is, it's 53 pages. And it actually shows you treatment points. Okay, we got the same thing for horses. We've got a practitioner manual that covers both horses and dogs. And the reason it's horses and dogs, when we started doing the horses, we found that most people who had horses had dogs. We've got therapy manuals for practitioners, for people, and it shows you very simply how to treat like a sinus problem. Okay, and just those points you would use. Now those points are actually acupressure points that we would have to teach you the whole system in the body about what are acupuncture points, and 380 plus, we don't want to go through all that, so it makes it real easy just to go through point 1, 2, 3, 4, 5. We have a second practitioner manual, and we have what we call our layperson manual. We'll go over this in a little greater detail in a few minutes. So, and that's very important as far as working with your people. So from layperson guides for dogs and horse owners to professional manuals for practitioners that are working with humans and animals, each booklet is concise, it's practical, and it's rooted in lived experiences. So whether you're a first-timer or a seasoned practitioner, Our manuals are designed to meet you wherever you are and guide you and your clients towards transformation. So, lastly, I want to be about becoming a wholesale partner with NWT Wellness. It's a simple process, it's empowering, and it's designed to help you bring transformation directly to your clients. Our wholesale program is one of the most easily accessed in the industry. All you have to do is visit our mobile site. Use your phone, use your tablet, and go to New Wave Therapy, that's all one word, newwavetherapy.square.site. Open the menu and select Wholesale Accounts, and you'll have an email form there. Just send us your request. And let me show you what we actually consider our wholesale account. When you purchase just 4 layperson therapy packages at wholesale pricing, you're officially a wholesale account holder. There's no tax involved, there's no shipping involved, just a clear path to offering professional grade tools as well as creating a second stream of income, all rooted in the legacy of one light, 3 lives transformed. And that comes from us using just the red light therapy on people, dogs, and horses. So 1 light, 3 lives transformed. So we're proud of what we built over the past decade, even more excited about where we're headed. And I invite you to learn more, experience it for yourself, and join us in shaping the future of light-based therapy. So until next time, be well, stay curious, and keep listening to the pulse.